Do you know how important giving a painless injection is? It's one of the most important things people consider when selecting a new dentist. Have you considered buffering local anesthetics? Very simple. A little bit of sodium bicarbonate is placed into the cartridge, and what happens? The sting is gone. Why is the sting gone? Because the pH has changed. And rather than running to play with the hygienist for a minute while the anesthetic takes effect, you start treating immediately. Septicaine is the most popular anesthetic out there at the moment, and there are others that have the same material in, articaine. But is the needle orientation you're using the most effective? Needles are not necessarily needles. That one has bevels on it, as you can see. Some do not. There are a couple of these that have bevels on. That bevel slips in so easily. There's another one, Septodont, that has bevels on it. If you can see that photo, you'll see the edges are such that they're like a knife. It's not just a blunt edge. If you tend to move too fast, which many dentists do, they want to just get in there and get it over with, this DentaPen from Septodont works remarkably well. You set it for how long you want to take to do that injection. And in doing so, it controls the amount of pressure to make that equal to the amount of time you've set on it. The DentaPen, very simple, easy device to use, comfortable to the patient. The secret to a good impression is not just singular. It's not just going slowly. There are other things that are very important. Let's look at a few. That looks like a target to me. Where do you think it's best? Well, I have a hint there for you, the palatal anesthesia device. That little circle can be placed on the palate after you have initially placed a little bit of topical anesthetic. That topical anesthetic is used improperly most of the time. Most dentists will put it on immediately, squirt the anesthetic. That local anesthetic that you're going to provide will hurt if you do not have some minor anesthetic result there before you inject. And that takes about 2 minutes, 1 to 2 minutes, and the tongue starts to get numb. You haven't injected anything. You've just put a little topical on. That circle provides pressure for many, many years. I have used just the end of a Q-tip, which is wood. I'll show it to the patient right in front of him. You see this piece of wood? I'm going to put it on your palate, and I'm going to push very hard. It won't hurt at all, and that makes what we call pressure anesthesia. You'll feel pressure, but that disguises the penetration of this tiny, tiny needle. The harder you push, the more it blanches and turns white around that stick, or in this case, that mechanical device. You can slip that needle in so easily, they will feel nothing. In fact, I could say fairly candidly, after many, many decades of practice, that the palatal injection can be one of the least painful of all the injections you provide. Now, accompany that with what I call mental sedation. What's mental sedation? You're talking about every bit of the process. You don't just jump in there and squirt. You basically give them every indication that this is going to be as painless as you can make it. That I always say I'm going to go very slowly and gently, and the patient appreciates that. They will select you over other dentists, even though the other dentist might be better than you or me, if the injection is painless. All of us can do it with a few simple things. Take a look at buffering, take a look at sharper needles, take a look at pressure anesthesia, and you will have very painless injections. Thanks for being with us. Join us next week.